IVF, or in vitro fertilisation, is a technique where eggs can be taken from the body and mixed with sperm in the laboratory setting in a petri dish and incubated to grow an embryo. And once the embryo has reached a certain size, it can then be transferred back into the uterus to implant. It's a very useful fertility treatment and is used in different scenarios, such as when we find that the fallopian tubes are blocked, when the sperm quality is poor, perhaps when the egg reserve is low, when we are considering egg donation, or when we are considering unexplained infertility, we can't find a cause and we're trying to encourage the process of fertilisation outside the body since it's not happening naturally. During the process of in vitro fertilisation, we will be providing the female partner with daily fertility injections. These are normally taken as subcutaneous injections, and you learn to do them yourself. And we arrange for you to come around 3 or 4 times over the course of 2 weeks to attend for ultrasound scan monitoring. Normally that's just to allow us to see how the ovary is responding to the fertility drugs. So what's happening inside the ovary is that the small little sacs that contain awake eggs are encouraged to grow in synchrony. So rather than actually just having one egg grow as in a natural cycle, we'll encourage several of your eggs to grow at once so that we can collect them. And the purpose of the scan is to make sure that the response is safe and that it is as we would expect it to be, so that we can get a good result. Once we feel that the follicles have grown to a sufficient size and that the eggs inside are mature, we'll arrange for a final injection which matures the eggs and allows us to collect them. The egg collection is performed in our sort of operating theatre, and it's done under sedation, a form of anaesthesia that allows you to be asleep and very relaxed, or if you want to be a little bit more awake, but it's not a particularly painful procedure and probably takes between 10 and 20 minutes for one of our fertility consultants to collect the eggs. And during that time they will scan you internally when you're asleep and place a needle into the ovary to collect the fluid from all the little awake sacs, little awake eggs that are in the sacs of fluid. And that fluid is then passed in a test tube to the laboratory scientist or embryologist to be then stored ready to mix with the sperm. On the day the eggs are collected, if you're having in vitro fertilisation with your partner, then your partner will be invited to produce a sample of sperm. But if you're using donor sperm, that will be the day that we will thaw a sample of donor sperm to mix with the eggs. So once you've had the egg collection, you'll have something to eat and drink, and we'll make sure that you're fully recovered, and then you can go home. But it is a minor procedure. It's a bit like having a blood test, but obviously it is a very tiny needle that goes through the vagina. So it can feel a little bit like slight period pains for a few hours, but most people will find that they just take that day off work and they're back to normal activities the next day. So meanwhile in the laboratory, we'll put the sperm and the eggs together in a dish in an incubator, and they will stay there together overnight, and the following morning we'll check to see how the eggs have fertilised. Once we've measured the fertilisation, those fertilised eggs will be allowed to grow for about 5 days until they reach what we call the blastocyst stage, when they're normally sort of 120 to 160 cells in size, and we can see very clearly there's a group of cells which will form the baby and a small ring of cells which will form the placenta. And then we will select the very best embryo to transfer back into your body, and we will allow any other top grade embryos to be frozen, potentially for future use. The embryo transfer itself is done in a small room right next to our laboratory. It's a lovely moment, and if you can bring a partner, or you can bring a friend, parent, and you will have an internal examination, and the embryo that's selected to be transferred will be placed in a very fine tubing and passed into the perfect position in the uterus under ultrasound scan guidance to hopefully implant. There'll be some medication to be taking around this time, which is called progesterone, and we'll show you how to take that, and then your pregnancy test will be 9 days later. For some people, we encourage you not to have an embryo transfer, and that might be because you've produced perhaps too many eggs, you're at risk of something called ovarian hyperstimulation. Perhaps you've decided that that's the way you want to go, you want to actually have a pause, not quite ready to start your family at that point, or you don't feel very well, or because there might be something we've seen on the scan, perhaps a small polyp in the uterus, where we would advise you potentially to freeze those embryos, and they'll be very stable and frozen, ready for you to have a frozen embryo transfer at a later date.